Coronavirus is changing the world we live in. The Pine News is conducting a series of interviews with professionals in the international education industry to see how their organisations are being affected. In this episode, we look at mental health in the time of COVID-19 and how organisations are trying to support students. Joanna Storti is Head of Education at Sonder, an on-demand support and assistance app for students. Rahul Sondhi is an international student who was studying his A-levels before he was repatriated from the UK. Douglas Little is Project Manager of International Student Mental Health at University of Nottingham. Cecilia Pereira Yates is Managing Director of GB8, a company that specialises in international student recruitment. Elizabeth Kumbari is Vice President of Professional Exchange Programmes and Legal Counsel at Cultural Vistas, an organisation that facilitates internships and professional exchange programmes for visitors coming to the US. And Ursula Laban is Executive Committee Member for the European Students' Union. They looked in detail at the main challenges around supporting students in difficult times.
I was told by my landlord that if I don't have enough money to pay for my rent, then it's going to be tough. Like, I'm going to have to leave because he has his own bills to pay. The day after I was told that I'm going to have to leave, I had an anxiety attack, and I tried speaking to my friends, but most of them were asleep. And so I had to take like a medicine to go to sleep because I was not able to sleep that night at all. And the next day I spoke to my friend Eddie, and he explained me about what I can do, and if I can contact some local NGOs, they would help me a lot. And for anxiety, he told me some stuff that I can do to help calm myself down. And apart from that, I didn't receive much help during that period. Contacting my school, there was just one teacher that I spoke to, and he said that, like, according to the law right now, they can't evict me, but I was not living on a proper contract, so they didn't know what's going to happen if you're not living on a proper contract. I was supposed to leave on the 9th, and luckily a guy from Air India called me on the 7th saying that there's a seat available on the evacuation flight on the 9th. So luckily I got my tickets 2 days before I was supposed to leave, and on the day I was supposed to leave, I got my flight back to India.
A lot of students have lost their jobs, they have lost their financial income, and changes. There were a lot of changes in housing situations as well. A lot of students were forced to move back home or to live with their roommates and study from there. And all of this has put a lot of pressure on students. So I think a lot of students have, besides the fact, of course, that there was like some virus going around, there were also a lot of things that were affecting mental health of students indirectly.
I think the challenges are profoundly that we haven't actually got students on campus. So the inability to provide that face-to-face support, and I mean that either through formal counselling or mental health sessions, but also, you know, we're not able to exercise together, we're not able to socialise together in the same way, and universities have had to adjust to that in a really profound way and challenge some of the assumptions that have been made, and a lot of that has meant around migrating a lot of their support online.
We're seeing at Sonder over 60% of the student requests that we receive are after business hours. At all hours of the night, we're assisting students with mental health concerns and issues. This is a challenge for institutions to provide that reach and that on-demand support as required. Universities and education providers just can't solve this growing need or fully support students on their own, but I think through partnership we absolutely can.
That there's some really good practices that I see where they've given very specific information about the kind of support that they can get whilst they're on campus. And also, you know, with the borders closing, what I found very heartening is seeing how quite a number of universities put forward strategies to help the students to go home as well. And I found that that was really helpful. And some of the information that they've given on the web, for example, it's very clear for the students to where they can access support. So I think some universities have done that really well.
So coming from European Students' Union, we have also been seeing a lot of great projects, action initiatives taken from our member unions, from national unions of students. Not only they've been really working hard at lobbying and advocating for students to secure some financial aid, some financial support for students who have lost their income during this time, and also to kind of like monitor the process of online learning and online teaching in their countries. Some of them have also taken like great initiatives and great projects to kind of support the mental health of students and their well-being during this time.
We've found ourselves where our international students have had to very often and very suddenly return back to their home countries. And this has created some profound problems for them. So, for example, if they are currently receiving formal treatment for mental health conditions, it could be that they have left without their medication. It could be that they've left partway through their counselling therapy. And there are particular challenges around for universities around their student well-being.
I believe mental health is always a challenge with an international audience because many cultures view mental health concerns in different ways. And so individuals raise their hand or ask for help in varying levels and in varying ways, and sometimes in urgency. And so an organization like ours may receive an email from a participant that says, I'm feeling kind of down right now. And that may mean they're very depressed. Or we could receive an email that says, I need a counselor right now. And that may just mean that they're kind of having a bad day. And so I think it's understanding the urgency, sometimes in cultural context, and understanding how to respond accordingly.
With growing mental health issues across our student communities, technology is enabling scalable solutions to reach more students, reducing the barriers to access support. I think technology is also enabling us to literally get help straight into the hands of students through their smartphones. So access to support is on demand, and it's always there whenever they need it. I think technology is helping to create new behaviors on how we access support and how we deliver support, similar to how technology has changed how we connect and communicate through social media, how we commute or order our takeaway delivery through Uber. Our behaviors have shifted in these areas as a result of new technologies, and student support is no different. I think in terms of the opportunity to connect more people with the help they need through a swipe of a button on their smartphone is a really powerful tool.
In the context of internships, that supervisors are actually really considering the intern as more of a whole person and thinking about what they're doing in the evenings, and they're considering what they're thinking about in the context of their day-to-day life in a much more proactive way. And so supervisors are often assigning ambassadors or assigning somebody who works in another area of the company who may be from the individual's host company. And so I guess what I'm seeing is more very intentional support in ways that are not directly pertinent to on-the-job training. They're actually caring about the individual's cultural experience in a way that is more holistic than we had seen in the past.
Well, a positive that has come out of the outbreak, I think, is that a lot of people are talking about mental health in a way that I just don't think was happening before, and at a global level. So, I mean, this week is the Mental Health Awareness Week, and because of the isolation that a lot of people are feeling, and because of the, incredibly difficult times that everyone is having, I think everyone is really listening to one another and communicating with one another about what those challenges are in a really open and transparent way. And I think that's sort of broken down the assumption that everyone's okay. And I think it's making people ask, you know, again, a second time, like, are you really okay? Because the circumstances that we find ourselves in, you genuinely know that if someone says I'm fine, that's not necessarily going to be true because of the challenges that we're all facing. So I think it's added a lot more depth to that conversation in a way that, you know, a challenge like this hasn't brought about.